Alex, you can.
Good afternoon, Namaskar. I am Dr. Chetan Mundada. I am Pediatric Critical Care Specialist and Senior Pediatrician at KIMS Cuddles, Minister Road, Secunderabad. I hope all of you are having a good day so far. And the reason why I'm here is because now the summer is upon us. And many of the kids, they must have already finished their exams. And some are undergoing exams, and then there will be vacations. So for kids, it is a really time where they look forward to it. But for parents, sometimes it can be really difficult. So there are various things which they are worried about, and I'm here to just speak about few things which are mostly common sense, and most of the parents, they know about it. It's just like some expert tells them in the same in a different manner. It has an impact. So आशा करता हूँ आप सब लोग मजे में अपना दिन गुजार रहे होंगे एंड गर्मियाँ अभी सर पे है और बहुत सारे बच्चों के एग्जाम्स खत्म भी हो गए और कुछ के खत्म होने में है और अभी छुट्टियां आ रही है और वो सारे एक्साइटेड है एंड समर में हमें कुछ चीज़ों का ध्यान रखना है तो विल बी जस्ट स्पीकिंग अबाउट ऑल दिस थिंग्स. Now, first and foremost, this time what we feel is the summer is going to be a little harsh because it's just the first week of March. It's been very hot, and there are no dips of temperatures which we usually see in last few years. We've been seeing that in the mid-February onwards, there will be little dips of temperature, a shower here and there, and the temperature will cool down. But the sun is relentless this time. And we have to be very careful now, especially when there are kids in the family. And because they want to have good time, they want to keep playing. And at the same time, we have to make sure that they are not getting heat stroke and not getting dehydrated. So first and foremost, little precautions for children. So as the summer comes into fore and as the sun gets harsher and harsher, we have to ensure that the outdoor activities, which as a pediatrician we always promote, but we have to be a little more cautious whenever children are going for any outdoor activity. So the harsh sun, right? Say it depends on place to place, but after 9 to 10 in the morning, up to 4 to 5 in the evening, it's really harsh, especially in April and May, and we have to be very careful when you are venturing out. Whether it is a simple shopping or whether it is some outdoor activity or kids playing a game or two. So the timing has to be important. So the day starts early, so we can use the early morning time for all the activities where children can have enjoy the outdoor games and activities. At the same time, it won't be that much of a harsh sun. When it comes to maintaining health in summer, first and foremost is the hydration. So पानी अच्छे से पीना है और बच्चों का आजकल हम ज़्यादा देखते हैं कि पानी पीना उनके लिए एक बर्डन है. It is little bit of a time consuming thing for them. So they would skip drinking water or drinking any liquid for that matter because they feel that they are losing time on playing or doing something, whatever they are doing. So we have to keep reminding them about maintaining hydration. In bigger kids, it is much easier, but in younger kids, we have to sometimes the infants, small babies, they won't be after 6 months. We do advocate them to have water all the time. in between whenever it is needed. So how do you engage them in getting? So we can take help of various things. So making things little more attractive always plays an important role. So having some different kind of zippers with different colors, little bit different mechanism. So the child once they start, they're able to hold the objects with both of their hands. They themselves can do it, and many parents they find it very useful to make us a game out of it, something where the simple drinking water is also a game, and that's how you can actually make the child drink either water or other liquids which you have home liquids which you have prepared. So how do you understand in a small child uh, whether he is adequately hydrated or not? So first and foremost, the child has to be active, it has to be playful. A dehydrated child will be little lethargic or dull. Uh, Another important thing is how is the child peeing? How is the child passing urine? Is the urine very concentrated or darker color, or it's normal color, especially in the daytime? It's normal color urine, normal quantity, the routine with which the nappy weight and everything. Uh, it's not totally different than what it is in the on a routine day. Then that means the child is having adequate hydration. These are simple things. You don't have to be a doctor to know that the hydration of the child is normal or not. This is simple tips for a small child. For bigger kids, they themselves can many times tell that how are they passing urine? Is the urine very dark or concentrated, or they feel thirsty? They can themselves tell. But we have to keep reminding them, and we have to ensure that they are drinking enough liquids. So sometimes it's not just water; they can have other substitutes of water. So things like buttermilk, which is made of homemade curd, which is freshly made curd, and coconut water or a simple lemon juice with a little bit of salt or black salt and a little bit of mint leaves, or just to have garnish and have it in an attractive glass or a little different presentation also makes kids have all these home liquids. You can also prepare soups of various kinds, and also sometimes there can be some smoothies and shakes and juices. As a pediatrician, we always are very much against juices for older kids because we want them to have the fruit, the whole fruit, and not to miss out on the fiber part, not to miss out on the chewing part, so that they get the whole goodness of that particular fruit, rather than just having a juice where they won't get the fiber and they won't be their gums won't get the exercise to chew the fruit. So that's also equally important. But younger kids, yes, we can have all kind of homemade juices. Again, if we can avoid having the tetra packs or the packaged juices and packaged foods, that is always good, because something which is freshly made is it's in front of your eyes in by you yourself can always is always better as compared to kids having a Tetra Pak, and we don't know how they were stored, we don't know how long. Sometimes by mistake you don't see the use by date and it is beyond the use by date. And there are lots of WhatsApp videos you might have seen where fungus is being seen in these Tetra Paks. So always good to have freshly prepared juices. For bigger kids, better to have let them have the fruit. The fruits which you can have in this season is all the fruits with a lot of water content. So watermelon, muskmelons, oranges, grapes, they are all good fruits to have in summer. And all the seasonal fruits in the particular season are always good. So now the mango season is coming. You can have mangoes as well. It won't be quenching the thirst, but yes, you can still have enjoy the summer with mangoes. Uh, Terika pani is a very fondly prepared and savored drink in summers, and again That also gives you adequate amount of salt and water and little bit of carbohydrate. So all these things we have to ensure. So when you offer a variety, when you are reminding the kids to have water as well as some at some point of time a little bit of a say a lemon juice or a curry ka pani or a buttermilk and fruits which have good water content. So that always helps. So this is regarding the hydration. The other thing which comes to mind is the clothing. So typically, again, it's a very common sense thing. That typically, cotton clothes are always good, and so uh, clothes made of cotton, and depending on the weather, it can be a half sleeve or shorts. It can be full sleeves and full pants, depending on the child's preference also. And when you are venturing out in the sun, uh, you have to also, if it is going to be a little longer activity or longer game of any sort, or you feel that it's going to be outdoors, the child is going to be for a longer period of time, it's always good to have to apply a sunscreen. So sunscreen, they come in various ways. So you can have a sunscreen with moisturizer, which again is a very good thing to have. And there are SPF, the sun protection factor or sunlight protection factor. So the SPF is very important to know. So SPF minimum 30 SPF is a good thing. Where in tropical country like ours, where the sun is really harsh, we need to have sunscreen with an SPF of around 30. Which so what exactly is SPF 15 and 30 and 50? So basically they block the harmful ultraviolet B rays from roasting our skin, which are present in the sunlight and which can be very harmful. They can have not only sunburns, the prolonged exposure can lead to skin cancers and a lot many other problems. So to prevent these things, these complications and the sunburns, we have to use the sunscreens. So a sunscreen with an SPF of 15 is supposed to filter out 93% of the harmful ultraviolet B rays, and a sunscreen of around 30 will be protecting around 95%, filtering around 95% of light, and the sunscreen of 50 and 50 plus will be 97 to 98%. But having said that, if we are using a higher SPF sunscreen, it is always good. It's also depends on how you are applying. So it has to be liberally applied. It has to be reapplied from time to time, especially if say you had a swim. आपने स्विमिंग किया है तो स्विमिंग करने के बाद obviously that sunscreen which you have used earlier, applied earlier, even if it's half an hour ago, you have to reapply if you are going to be in the sun for a long time. So it's very important, not just the SPF you should be focusing on, how you are applying, apply it properly, and remind yourself to reapply if you are going to be in the sun for a longer period, and apply for all the exposed area of the body. And so 30 to 50 is something which is the recommended one. And if it is associated with, it's mixed with moisturizer, then it's even better. So this is about the sunscreen and the color of the clothing. So we all know that the darker color, even if it is say black or red or very dark colored clothing in the harsh sun, because it will absorb more light and it will make you feel hotter. And the whiter colors, the pastel colors, they are good to wear. And cotton clothes, because you perspire through it and it can keep you cool as well. So having enough sweat is very very important, so that means that you are not that dehydrated. If you are very dehydrated, you won't sweat and you will have a temperature or what we call a dehydration fever. So it's very important to remain hydrated whenever you are venturing out. Now, another thing which happens is, especially for kids, is how do you keep them engaged? Because now, at least in the school, when they were having schools, they were going out for at least 6 to 8 hours in the day, and parents would do their activities, would do their job, would do their home chores. But now they are there at home, and obviously they will either feel bored that we're now sick of being in the home. We want to venture out, and because of the harsh sun, you are worried obviously that this is how do I manage. So you have to find out ways of engaging them. So engage them in various activities. They can learn a hobby, or they can learn a skill, and they can do it on a regular basis. So that becomes, and it also teaches them a little bit of discipline and a focus. And also they can play with their peers, their friends, with some board games or some other games, and even our traditional games, which nowadays are have taken a backseat. So, but we can again reinvent them, and in a contemporary manner. So many parents do this very tactfully, and children can get engaged so that they stay indoors when you really want them to in the afternoon noon sun. They have to be indoors, so that unless they are really required to be out, so that they don't get exposed to the very harsh sun. So engaging them in various activities, in putting them to some sort of, either it can be an online teaching, or it can be a activity done in the premises of your building or society. So those kind of things also we have to think of. Now, another important thing which parents also ask, like, what should be the diet in this summer? So there is no particular diet for summer, but yes, what we want all the parents to avoid is very deep fried and very oily things, because that makes you feel more thirsty, and it needs a lot of water also. So that's something which needs to be avoided. And again, as a pediatrician, I always tell all the parents of my patients that they have to keep a check on the packaged food. So the packaged food which we see, they are all rich in all this oil. They are rich in hydrogenated vegetable fats. They are very much salt rich and sometimes sugar rich as well. So the packaged foods, because of the relentless onslaught of the advertisements on the overall peer pressure, every child is looks after having this thing very regular. But we have to ensure that the intake is not on a very regular basis. It has to be once in a while. And again, for that, you can have substitute of homemade snacks, and other, a fruit salad prepared in a very, in a attractive manner, or garnished with various other things which the kids like. And even putting wooden forks, like for a small child, that is also a novelty. So that also is a skill which he or she acquires. So having, using a little tax here and there, can make the child's overall summer very enjoyable. And so the otherwise, food wise, you can again insist on having more fruits and vegetables, especially those which are good in water content, and refraining from various junk food, too much sugary drinks and beverages. So apart from that, all other things you can have, and especially many parents, they ask about, what about ice creams and what about cold drinks? Some are, everybody associates with them, and I think you should allow your kids. But some kids who are allergic, especially if you know that the child has got, every time he or she eats or drinks something which is very cold, very chilled, or a frozen food or ice cream, and they immediately catch cold or cough, then we have to be little careful. So in that case, we can try various things like let the ice cream melt a little bit and then have it, and immediately after having the ice cream or any other very cold item, they can have a little lukewarm water. So the transient drop in the temperature sometimes causes our immune defenses to dip down, and it then leads to an attack of the virus or bacteria which are present in the environment, but our immune system constantly keeps fighting with them. So these are the ways we can work out, and this is how I think if we go ahead with the summer will be really really enjoyable. And we from the Cuddles family, Kim's Cuddles family at Minister Road, we wish all the children and their parents a very happy summer. Explore our country, our beautiful diverse country, explore the world, and just take care of your health. Be hydrated, wear cool, pastel color cotton clothes, and also wear the hats and the caps and the sunshades. And do remember to carry a sunblock or sunscreen with you, and keep applying whenever you are venturing out in sun. If you are there in the sun for a longer period of time, apply it couple of times more. So, and keep hydrating yourself. Always carry a water bottle with you when you're venturing out, and this holds true for even adults. So remain hydrated, eat nice things, good things, healthy things, and enjoy some. Now we can have more questions. So can we have the questions, please? Which are there?
Yes, sir. It's pretty. It will be shown below. What precautions should be taken in summer for
Yeah.
5-month old baby?
So 5 month or like for young infants, again, we advocate breastfeeding till 6 months, which is exclusive. Exclusive means you don't even need to give water in these kids. So kids who are normal, who don't have any loose motions, who don't have any vomitings, they are not having extra losses. So even a good exclusive breastfeeding, like only mom's milk, is sufficient to quench their thirst and is sufficient to provide nutrition as well as hydration, provided the mother feels that she has got good milk secretion. So lactation, the mother understands and she feels that okay, I am having enough. So for that, she has to understand that she has to drink lots of liquids. So for an adult, usually 3 to 3.5 liter, 4 liter liquids we recommend, and in summer it has to be more. And for a lactating mother who is feeding their babies, because their whole water requirement is met by mother's milk, they have to even have that extra. So mothers have to have extra water or extra liquids in the summer months, especially if they are lactating and they are breastfeeding the kids exclusively, then it is very, very important. And they should be having a good, normal, healthy diet, which is wholesome, of comprising of all the protein, food, fats, and carbohydrates, along with the fruits and vegetables. So that is the first and single most thing. And then keeping the surroundings little, acceptable. So around 26 to 28 degrees centigrade is the temperature which is recommended. We call it as thermoneutral zone. So this is the temperature we want. So people who have air conditioners at their home, they can have the ACs on when it is very hot. Many a times people design the homes in such a manner that they have good ventilation, and you may not need the air conditioners or coolers as well. Simple fan suffices many times. So keep the surroundings cool for the child, and ensure, as I said earlier, that how you determine that my child is well hydrated, how the child is peeing. So a 5 month old or a 6 month old child will have passed urine every 1 2 hours, and the mother knows the pattern. So the the weight of the nappy or the number of diapers the mother has to change, or the pants the mother has to change, and the quantity of the urine as well as the color whenever the child passes urine. If they are on in the diaper, if the diaper is stained very heavily yellow, that means there is a chance that the urine is concentrated and the child is dehydrated. So in certain situations, we do recommend, apart from exclusive breast milk, so if the child is having vomiting, loose motions, or excessive sweating, because of which the child is getting dehydrated even at 5 months, we do recommend them to have water in between, which is properly filtered water, which is boiled and cooled, so they can have this kind of thing in between. And the next question is,
How much physical activities is suggested for the kids in summer?
yeah, so physical activities, you can. It all depends on the child to child. So what we want as pediatrician, they should be active all the time. They should spend a lot of outdoor times doing physical activities rather than sticking to their mobiles and other electronic devices and TVs. So as much as the child can endure, you can make them let them get engaged in physical activities. And various important benefits of outdoor physical activities is, one of the most important thing is it boosts the child's immune system. And if we are making them play something like a team sport or something, so they get lot other skills as well. They know how to manage people, a team spirit. They also know about competitiveness, and at the same time how to be mindful of others needs and others contributions. So there are various things. And another important aspect is the development of the child as well as the eyes. So a lot of children have this myopia, and those kids who engage in outdoor physical activity, they have good eye growth and they have lesser eyesight problems. So in fact, in certain countries, in where the childhood refractory errors are very common, like China and Japan and Southeast Asian countries, so they have started having their classes in such a manner that there is enough sunlight. There is enough sunlight, so that is how they are making the kids get exposed to sunlight for many hours in a day, and that's how they are increasing their improving their eye growth, and they're reducing the refractory errors or the degree of the refractory error in the kids. So it has got various benefits. So let the child get physically active, and they can do till the time they endure, but ensure that they are well hydrated, they are well fed, they are well nourished, and somebody has to monitor or supervise what they are doing. So as long as there is a supervision, and as long as they are maintaining good hydration as well as nutrition, they are free to go. Let them have a good time now that the vacations are upon them. So next is, most kids refuse to eat meals and regular meals. So again, I mean, whatever we speak of as a pediatrician on whatever topic, it all comes down to meals, and especially like my child is not having enough. So no mother or many parents, they feel that their child never has enough. But the thing is, let the child's oral intake, especially if they are bigger ones, that be guided by their own hunger. And for that, couple of things which we as parents should understand is, do not uh, give any mobile or any other devices, or not let them watch TV while they are having their meals. So the whole focus has to be on the food when they are having food. That gives the child the overall experience, when if they're hungry, they're eating and they get satisfied. So they understand that what hunger is, and I feel better once I have food. So this concept needs to be drilled in them very early on. That then solves the problem for the parents most of the time. So avoid giving them in between a little tidbit here and there, a little biscuit or a cookie or a chocolate on somebody coming at home and adorable kids and they will shower them with a lot of all these goodies. So make a pact. They can have all this during their meal time so that their appetite doesn't get killed by something which they have had. So if just half an hour before the normal meal time, if the child has a cookie or a piece of a chocolate, then obviously he would be more interested in continuing his play or a game, and he won't be very keen on having food because he doesn't feel that hunger now. So it's important to club it. You can just tell them that okay, you can have this. Your grandpa has got this, but you have to have it when you are having your meal or after you are having your meal or in between your meal, and then they can continue having their meals. So we have to again keep devising ways of avoiding this in between meals tidbits and little things so that the child feels hungry and there is no point in keeping on stuffing inside the child's mouth every 2 hours, every 3 hours. They don't need it. Once they are grown up enough, they have good stomach capacity, they have good digestive capacity, and they have good enough fat in their body where they can sustain a little bit time without having any food. So let the eating be guided by the child's hunger. That is the first important thing. And avoid a lot of junk foods and sweet and very sugary items all the time. Once in a while, they can always have it. So we'll move to next question. So again, traveling with children in the summer, as I concluded my talk, so ensure that they are well hydrated at all times. When you are venturing out, you are exploring a new place. Uh, be enthusiastic about it, but take adequate precaution. So if you can have umbrella, you can have hats and caps and sunglasses, and wear a sunblock or a sunscreen. Apply it liberally, at least SPF of 30 and keep them well hydrated at all times. So when you are having food which is outside, ensure the hygiene. Ensure like there are many roadside shops and all. So especially the sugarcane juice and other juices, ensure that the place is hygienic. There are not of lot many flies around nowadays. There are newer machines where they're all closed and sugarcane just goes in and you get a juice. So something like that you can explore so that the children, because this is the time summer where lot of foodborne, waterborne diseases we see, in which typhoid and jaundice and hepatitis A and other diarrhea and dysentery we come across. And it's very important when you are traveling, you ensure the hygiene and the hygiene of the food they are taking and the drinks they are having and the water. So carry water which is either filtered at home or you can have potable water outside, but ensure that all of this is hygienic. That is very, very important. And ensure that they are well hydrated. Wear clothes which are airy, which are cotton clothes and which are little lighter shades so that the kids won't feel very hot. Then how can we prevent children from getting heat rash in the summer? Again, the same thing, using sunscreen, using protective clothing, and limiting the time of venturing out in a very harsh sun if it is possible. If you are at home and not exploring your places. So, again, we have. Are the ready to eat fruit squashes and juices good to give it to the child? these fruit pumps contain too much sugar. Yes, absolutely. So these kind of things you can have it kind of a once in a while, as I said, very in a very detailed manner. Having fruit juices for young kids who, for infants or the toddlers who don't have full teeth and chewing is a little questionable, or you are worried that they may choke. There you have to give juices, but again, do not add any sugar. Little bit salt sometimes is okay. So let them have the juice, and nowadays there are various ways you can still give them food with their where they can have in a filter, and they will just grab the juice, and you don't have to even provide juices. So having soft mashed fruits is also fine. So squashes or ready to eat, everything which is packaged, be very careful. Keep a habit of reading the labels and find out the sugar content, find out fat content in various packaged foods, and what sort of fat is there. Is it a hydrogenated vegetable oil or palm oil, or is it some other oil? So again, the person who has asked the question, they themselves has answered, I think, that they do have too much sugar, and which is not actually required. Once in a while they can indulge, but it should not be a routine thing. What are the signs of heat stroke in children? How it can, again, prevention always comes first. So maintain good hydration, avoid unnecessary exposure to very hot sun, and wear clothing which are airy, which are cotton clothing, which cool quickly. And what are the signs? So signs of heat stroke: the child will be lethargic and dull, will be very hot to feel, and temperature sometimes can go to 104, 106, 107 degrees also in a proper heat stroke. So prevention itself is important. I hope that nobody gets to that symptoms, but if we prevent it, we won't reach there. As I said, cold drink and ice cream, yes, you can let them have once in a while. Again, anything in excess is poisonous. Ati sarvatra varjaya, they say. So, but yes, some kids. Another question is for asthma kids and allergy kids. So, what are the safety tips? So, they also would want to indulge in all these cold ice cream and drinks, and many are the kids where their conditions they get triggered by consuming this. So, how do you manage or balance it out? So in summers, many times we do see that the asthma, the allergies, they do on their own. They get a little less severe. Most of the kids we do see that. Another thing is be in touch with your doctor if the child is on any anti-allergic medication or any anti-asthma therapy. Carry on with that as per your doctor's, pediatricians, or pulmonologist advice. And when it comes to the cold drinks and ice creams, once in a while, everybody can have them. Just ensure if somebody is little sensitive or gets cold cough very quickly after consuming that, they have to use it in a different manner. It need to be very chilled. You don't have to put ice in those cold drinks again if it is a refrigerated one. So less temperature is when a little more temperature rather will be better. And ice cream, the kids can let it a little let it get molten, and then have it. And after that, quickly just consume a glass of lukewarm water. And be careful about the drinks and the ice creams, which are again not from a very hygienic place. So that is important. So I think we conclude here. You can always leave your questions, and we'll get back to you in a week's time. And it was really good to engage, and it was very heartening to see a lot of questions. I hope I have cleared many of them in the discussion and in the when I was talking, and again when I was taking the questions. So enjoy summer, learn something new, make your kids learn something new, explore a new place. Ours is a very diverse country, and take care of your health always. Thank you. Namaskar.